Good day. Today we are going to deal with the brushing techniques. Brushing is the main method of self-removal of plaque and debris by an individual. The oldest toothbrushing method was described by Phones in 1930. Various brushing techniques have been proposed by various researchers since the early half of 20th century. However, each brushing technique has its own advantages and disadvantages. It is the duty of the dentist or the healthcare provider to aid and teach the patient about the various brushing techniques and recommend a particular technique that is suitable for that particular individual. It is important that the individual should perform the technique satisfactorily for adequate plaque control. This aims to evaluate the various brushing techniques, its advantages and disadvantages, and various indications and contradictions of each technique. So, the main method of prevention of various oral disorders like dental caries, gingivitis, and periodontitis is by effective plaque removal. Self oral hygiene maintenance is mainly by toothbrushing and flossing. It is important that an individual is aware of proper brushing technique that he or she has to follow in order to maintain oral hygiene and for adequate plaque removal. WHO defined dental plaque as specific but highly variable structural entity resulting from sequential colonization of microorganisms on the tooth surfaces, restorations, and other parts of oral cavity, composed of salivary components like mucin, epithelial cells, debris, and microorganisms, all embedded in extracellular gelatinous matrix. Toothbrush design, brushing duration, parental environment, and the brushing method, manipulative skill, and manual dexterity of the child are the most cited determinants of the effectiveness of toothbrushing. Many type of brushing techniques have been recommended by various researchers over the past years. The main objectives of brushing includes to prevent plaque formation, plaque removal, cleaning the tongue, and massage of gingival tissue. There are various brushing techniques. Um, the first method is pass method. The head of the brush is to be kept parallel to the occlusal plane with the brush heading covering almost 3 to 4 teeth starting from the distalmost teeth of the arch. The bristles are placed at gingival margin at an angle of 45 degrees to the long axis of the tooth. Gentle vibratory pressure is given using short back and forth movement dislodging the tips of the bristle. The Bars technique places emphasis on the removal of plaque from the area above and just below the gingival margin. So the main advantages of this method are effective. It is effective for removing plaque beneath the gingival margin, cervical areas, and sulcus. It provides good gingival stimulation. The disadvantages: it causes injury to the gingival margin. It is time consuming and causes laceration of the gingiva. The next method is modified base method or sulcus cleaning method. In this technique, the head of the brush is kept parallel to the occlusal plane with the brush head covering almost 3 to 4 teeth starting from distalmost teeth of the arc. The bristles are placed at the gingival margin at an angle of 45 degree to the long axis of the tooth. Gentle vibratory pressure is given using short back and forth movement dislodging the tip of the bristles. The advantages are: it gives good gingival stimulation, good interproximal and gingival cleaning. Disadvantages are: moderate dexterity of the wrist is required. We'll see about rest of the methods in the next session.